In America, we overuse healthcare because it's so cheap. We can start working to change the financial incentives for both patients and providers. For patients, we can make them pay more of the cost of healthcare so that they move back up this curve a little bit, still insuring them, but making them pay more. So for example, we can move to systems where poor people are fully insured because they can't afford it, but someone who's higher income, they should have a high deductible. They should bear the cost of some of their health care because they can afford it, and that will make them make their health care decisions more wisely. So we can work on the individual moral hazard by making people pay more for their health care. We can work on the provider moral hazard by removing the financial incentives to providers to provide excessive care. And the way we do this is by something called prospective reimbursement. Prospective reimbursement is basically saying to providers, look, the way things work now is you do a CAT scan on the guy, we pay you for the CAT scan on the guy. You do a surgery on the guy, we pay for the surgery on the guy. How about a different way to approach it? How about we say this guy is your patient? A guy like him, a 25-year-old healthy guy, costs on average $1,500 a year. We will give you at the beginning of the year a check for $1,500. You do what you want. You do nothing, you keep the $1,500. You go crazy and get 8,000 CAT scans, and it costs $100,000, you eat the difference. You doctors bear the risk. We've turned the financial incentives on their head. Now, instead of making money by giving CAT scans, you lose money by giving CAT scans. So basically what the bill does is it tries to set up incentives on both patients and providers to behave more economically. But the answer is it's still very small. We're still years away from really putting those incentives in place in a major way. And that's sort of the next round of healthcare reform that has to go on.